Many people that are high risk ask if they carry the BRCA genes, BRCA or BRCA, they're sort of interchangeable. Everyone has the BRCA gene, the correct gene. You have 2 copies on your DNA. Patients that have a BRCA mutation are patients that have a problem in one of those genes. So there's two pairs in the DNA. One is abnormal. That places that patient at a higher risk of getting cancer because that is actually a gene that codes for DNA repair. Cancers occur when you have a break in your DNA that leads to abnormal growth. It happens all the time in the body. Cells are constantly repairing themselves. The body is repairing those cells that are damaged. So when you have a BRCA mutation, you're unable to repair breaks in the DNA at the same rate because you only have one good copy of that gene. Therefore, those patients are at a higher risk of getting breast cancer. When someone has a mutation in the BRCA gene, their risk of getting breast and ovarian cancer is elevated. There are some other cancers that have an elevated risk as well, prostate if you're a male, pancreatic, and melanoma. But as breast surgeons, we obviously focus in on the breast cancer risk. So if someone carries that gene, their risk of breast cancer is somewhere between 50 and 80%. The numbers vary from year to year a little bit, but obviously that's sort of dramatically high. We often offer prophylactic surgery for those patients because the risk is so high. And because our surgery, which is the removal of the breast with excellent reconstruction, really reduces that risk. It never brings it down to 0, but it reduces the risk about 90%. So if you're looking at someone who has an 80% risk of cancer, we're bringing that risk down to 8%. That's lower than the general population. So most women will go that route. Some women aren't ready when they walk in the door to do that, so we increase surveillance and we're doing screenings, whether it be mammogram or MRI, we alternate the studies and we're doing something every 6 months along with physical exam. Patients ask, who should get tested? If you have a significant family history of breast cancer, prostate cancer in men, pancreatic cancer, ovarian cancer, in several relatives, several generations, we offer testing to those patients.